Do you know what neural tube defects are and how they affect the development of a child? Neural tube defects, or NTDs, are congenital birth defects that occur when the neural tube, the structure that forms the brain and spinal cord, fails to close completely during early embryonic development. This incomplete closure can lead to structural abnormalities and functional issues. There are several types of NTDs, but the two most common are spina bifida, where the spinal column does not close properly, and anencephaly, where the upper end of the neural tube fails to close, resulting in the absence of a major portion of the brain and skull. Spina bifida can further be classified into three types: spina bifida occulta, meningocele, and myelomeningocele, each varying in severity and impact on the spinal cord and nerves. The exact causes of NTDs remain somewhat of a mystery, but we do know that both genetic and environmental factors play a role. Certain genetic mutations or a family history of NTDs can increase the risk, as can inadequate intake of folic acid before and during early pregnancy. Exposure to certain medications, toxins, or maternal conditions like uncontrolled diabetes during pregnancy may also up the risk. The symptoms of NTDs can vary, but in spina bifida, you might see visible defects on the back, weakness or paralysis in the legs, problems with bladder and bowel control, and hydrocephalus, an accumulation of fluid in the brain. In anencephaly, the affected fetus may exhibit an absence of a large part of the brain and skull, severe neurological abnormalities, and a tragically short life expectancy. Diagnosis of NTDs can often be made during prenatal screening and diagnostic tests, such as maternal blood tests, ultrasound, and amniocentesis. Managing NTDs primarily involves surgical interventions and supportive treatments. In cases of spina bifida, surgical procedures can close the opening in the spine and reduce the risk of complications, while symptomatic treatment can address specific symptoms and associated complications. Preventing NTDs centers on folic acid supplementation. Women planning to conceive or in the early stages of pregnancy should take folic acid supplements to reduce the risk of NTDs. In summary, neural tube defects are serious congenital defects that occur during early embryonic development. Understanding their types, causes, symptoms, diagnosis, management, and prevention can help us better support affected individuals and work towards reducing the occurrence of these conditions.